Good afternoon. I'm George Latimer, Westchester County Executive. This is Tuesday, January 18th, and we welcome you to our weekly COVID update with also other issues that relate to Westchester County government. I'm joined by Deputy County Executive Ken Jenkins, who will be part of the report as well. The numbers in COVID, which we'll jump right into to start out this week, have shown that from the peak of Omicron impact that was about 10 days ago, we are now starting to decrease, and that's a welcome bit of news. We had as high a number of active cases as 36,345. That was on the 9th of January, and so here we are roughly with statistics about a week later, and we've reduced down now to 28,993 cases as of yesterday. That number's a little bit smaller as of Sunday. That number's a little bit smaller as of Monday, and we expect it to continue to drop. So that's a significant drop from 35,000 down to 28,000. It is a good sign. We expected there to be a diminution in the number of active cases once we got to the 2-week period of time after New Year's Day, which sort of caps off the holiday season of Christmas, Hanukkah, and a host of other activities where people get together socially. And as we've stated a number of times, it's our understanding that the greatest area of spread of Omicron, in general, the COVID virus, is in private settings, not in personal or public settings. So that living room spread is very prominent whenever there's holidays and holiday gatherings, of which Christmas, New Year's are most prominent. So to reach that number, 28,993 individuals that have active cases right now within the 10-day period of time. We also have seen a reduction in the number of people that are hospitalized. As of Sunday, we show 613 individuals hospitalized. That number has come down from a peak that was just this past Wednesday at 677 individuals, and we had a rapid increase over the course of the last month. If you go back to December, just a month ago, December 16th, we had 124 people hospitalized for COVID. That number went from the low 100s to the upper 600 range over the course of the Omicron surge. Now that number is starting to come back down. We're pleased that it's about 10% lower than it was at its peak, and we hope we'll continue to see that number drop. The fatality number, of course, is an accumulative number, and many times the impacts of fatalities follow all of the other actions. And even when the amount of infection reduces, the amount of hospitalization reduces, we sometimes can still see an increase in the number of fatalities as those people that are most seriously sick with underlying diseases succumb to the disease, COVID and or other related issues. We have lost now 2,514 Westchester County residents during the course of the whole pandemic, which is almost 2 years in duration. That number has jumped up a lot in the last month. If you go back to a month previously, that's about 150 more fatalities in that mid-December to mid-January timeframe. We lost a total of 60 people in the month of December, up from 7 in November, and now to have lost 150, and we're only halfway through January, is a very disconcerting number. But we look at the positives at the moment, that the extent of infection is down, the percentage of infections, the positivity rate or infection rate as it's reported has been down now over the last number of days. We hope that's a trend line that continues. We know it's not continuing everywhere in the nation, but it's certainly true here in New York and Connecticut and New Jersey and the metropolitan area. And we know that part of it is the discipline of our people, that our New York residents, our Westchester County residents have been vaccinated, relatively high levels of vaccination compared to rural parts of the state and other parts of the country, and that also our mask wearing has reduced the amount of infection. We understand that for some people that's a debatable point, but the statistics show pretty clearly that when people wear masks and take vaccinations, they have lesser impact of the disease and they spread the disease less aggressively. And that information is provable based on the numbers that we've seen here in Westchester County over the 2 years almost of this pandemic. A few facts that are important for us to note. Westchester County Center is now open for vaccinations again. It served as a vaccination center throughout most of 2021. The state relocated their energies with the Westchester Medical Center to their location in Valhalla. We've now reopened the county center with Westchester County Department running the vaccination clinics, and to do that alongside the testing component that is also going on at the county center at the same time. Pediatric vaccinations and third shot vaccinations are available now at the county center, And the testing that's there will occur at different times than the vaccine shots, so it's be in a different section of the county center, so you're not going to be confused as to which way to go. It'll be clearly marked if you're going there for testing purpose or if you're going there for vaccination purpose. The county center is sufficient space as well to queue people up who are waiting. We've seen long lines of people waiting for testing, in some cases for vaccinations, because the area that is administering either the test or the vaccinations is sort of small. There's not much of a waiting area. With the county center, we have a sizable area for waiting, and in this type of weather, it is a benefit not to have people out in the cold waiting to get either a vaccination or a testing. We want to thank the Westchester County Department of Health and the members of that organization for getting these clinics up and running. We've had a series of clinics around the county. Ken will point out some of the ones that are upcoming. I've made it a point to see many of them myself day after day after day, going to different school settings, from Yonkers and Chappaqua to Mamaroneck and New Rochelle and all the way up north to Peekskill. And each of these represents opportunities for children to get vaccinated and for adults to get their third shot vaccination. It's pretty clear that vaccinations matter, but we also know it's pretty clear that we have to make vaccinations easily accessible to people, make it as close to home as they can make it, to give them the greatest opportunity to be part of it. Appointments for these things can be made on our website, and we will post this on our social media. You can go to health.westchestergov.com, and you'll see this information available to you, health.westchestergov.com. And we'll also put it out through social media, through Twitter and Facebook and Instagram and so forth. There are some direct links that you can click on. I don't know if we're going to show them to you on the bottom of the screen or not, but you can go there for the third shots, which have also been called booster shots, and for pediatric vaccinations. And as we start to get into the issue of testing, there's also information that you can get from our website regarding testing. Free PCR testing is available at the Westchester County Center, but it is targeted for those people who are symptomatic with known exposures. So those individuals who believe they've been exposed to someone who has COVID or they have symptoms, they are the ones that we're trying to test to make sure that we can confirm with PCR testing, which is the higher level of reliability, that they have the disease and they go into isolation if they do. It's very important to sign up for this testing. This is not a walk-in scenario. There is a post on social media that we provide and that you can go to sign up for that testing. It's a rather long, elaborate information link. You can click onto it and get the information. New tests will be available every day at this scheduling and available through the website. If you want to test anywhere outside of those that the county are providing through the county center or any of our other satellites, then you can go to the New York State COVID Test Site Finder, and that's coronavirus.health.newyork.gov, blah, 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 blah. It's available for you to find on social media, on our website, so you can go and link. There is a phone line hotline that accompanies that, 888-364-3065, so you can click online or you can make a phone call, 888-364-3065, and that will get you some information. You can also get testing at the Westchester Medical Center, and that's in Valhalla, 914-202-4530. We've drowned you in numbers and websites and links and all these things. The information is not easily found in one single source. We try to pull as much of it together in one site, so we ask you to go westchestergov.com. Now, we've had great success setting up satellite locations around the county, and Ken Jenkins is going to update you on the ones that are coming. Some of them are second shot locations, but each of them have a benefit in being able to be out closer to you where you live in your community and give you the best possible access to vaccination. Ken Jenkins.
Thanks, George. And again, the satellite locations are at the county center are going to continue Thursday and Friday this week. You should be able to go on health.westchestergov.com and see those appointment times, and appointments are required for vaccinations at the satellite locations at the county center, as well as testing. And just a reminder, as County Executive Latimer just pointed out, again, those appointments are 3 days in advance. The new appointments are released 3 days in advance, so you have to continue to check. People do cancel appointments because they've been able to obtain testing at another location, and thank you all for doing that, to cancel those appointments and free them up. So if you check multiple times during the day, you can see that. Again, the vaccination satellite set at the county center is Thursday from 3:30 to 6:30, and Friday from 2:30 to 6 p.m. There is no service at the county center over the weekends or no service on holidays, as Martin Luther King birthday yesterday. Next week, there'll be various vaccination satellite locations, whether that's up in Croton on Tuesday the 25th, New Rochelle. That's both of those are second doses, so second doses only at the elementary school in Croton, and certainly Columbus School in New Rochelle on the 25th. Again, you have to look at the website and be able to identify if it's a second dose opportunity, or again, first doses, second doses, or boosters of the doses or third shots at the county center Thursday and Friday again next week. Really exciting news, again, on Wednesday, the 18th. So starting tomorrow, all Americans will be able to order free at-home COVID-19 test kits from the federal government, from the Biden administration's ongoing effort to curb the latest record-breaking coronavirus surge from Omicron. Near the end, in December of 2021, the Biden-Harris administration announced that they would be buying 500 million at-home tests to give to every U.S. household for free, and that purchase is somewhere around $4 billion for the cost. So again, you'll be able on January 18th to visit covidtest, one big word, .gov. I'm sure we got it on the scroll at the bottom of the screen, to order their free at-home test sites. And you can also go to the U.S. Postal Service and order from there at the special.usps.com/test kits. Again, there's going to be many places to do that. I believe that the limit is four test kits per household per month for that. That's in addition to what happened over this weekend, where you were able to hold your receipts for purchases that you made yourself. So starting Saturday, your insurance company had to cover 8 COVID at-home tests per month. So there's so many different options to be able to get vaccinated, to get your full set of vaccination shots. Again, just as we're going through making sure we call the sites satellite locations, we're going to make sure to continue to tell people to get fully vaccinated. It means the appropriate number of the shots. Remember, for Johnson & Johnson, that may be 2 shots, and for Moderna and Pfizer, that is 3 shots at this current time. Thanks, County Executive.
I want to reemphasize that point about terminology. It's not just sophistry. It's very important to understand that the satellite locations that we have operate as professionally as our established sites. They operate as professionally as a medical center site would be, or as one in your doctor's office. They are satellites of the main vaccination situation, and they're operated by people who are qualified and certified to be able to administer them. So the phrase that's been used a lot, I think the states use the phrase pop-ups. A pop-up sounds a lot like something that happens seasonally, a pop-up Christmas store, a pop-up Halloween store, and we think that's far too casual. These are satellite sites, and they're substantive, and they're important for you to understand that they have the same rigor from a medical standpoint as the standard sites do. Professionals are manning them. The other thing that we're arguing about in terminology is, what does it take for you to be fully vaccinated? We don't consider the third shots now as boosters. We consider them part of the basic vaccination protocol that you have to go through. Normally, you have a vaccination shot. 3 to 4 weeks later, you have a second shot, and then 6 months after that, you have the third shot. And that combination of 3 shots is what makes you fully vaccinated. And we've asked New York State to provide us data, and to provide that data in a fashion that we can then assess how many people have 1 shot, how many have 2, and how many have 3. The thought that you're fully vaccinated after 2 shots and then there's a booster, makes the booster seem more optional, and it really isn't. It's really part of what will protect you thoroughly from coronavirus. So we view, when we are administering vaccinations, we are administering the third shot of a 3-shot protocol. And I understand the governor of Hawaii has just made this the policy in the state of Hawaii. We'll see how the other 49 states respond. But we don't consider them pop-ups, they're satellites, and we don't consider them booster shots. We consider them the third shot that you need in order to be properly and fully protected. With that thought in mind, Westchester County has sent a letter to New York State asking for some very specific additional data. And I want you to know this, and we've made this ask, because when people go to our dashboard, they have natural questions. What about this? What about that? How come we don't know this, and how come we don't know that? Here are the things that we ask New York State to provide for us on a daily basis from their dashboard, which we can then adopt to our dashboard. The first thing that we think is important is to make the numeric case of how many people have been single-dosed, twice dosed, and 3 times dosed, and only treat the fully vaccinated as those that have had the 3 doses. And we need those statistics. Right now, what I suspect is we'll see a very high 1-dose factor, over 90% of our population. The second dose, quite behind it, but not that far behind it. But then the lag to the 3rd dose is one that is what concerns us. And that's why we're focusing on those shots, those 3rd shots, in as many places as we can to get that number up high. When that number gets up high, we have protected a larger cohort of our people. When we had vaccinations in January and February, March, and April, we did not know that we would need a 3rd shot, but medical science has indicated that that is a necessity, and so that is what we're arguing for. But we want those statistics from New York State. The next thing we want is very clear 18 and older vaccination absolute number and percentage, and under 18 vaccination number and percentage. If we want our kids to stay in school, if we want our schools to be open, we need to know what exact number of young people under the age of 18, almost all of whom would be school age, have been vaccinated. So we can track that number and try to move the needle and get that number up. If that number increases and there's a greater sense of protection, then we have a much greater chance to keep those school doors open, which is what we have all stated as a public policy. We do not want to close schools, and I've extrapolated beyond that to saying I don't want to shut down the society at all. Don't want to shut down industries, don't want to make it impossible for you to do certain things. But we do want you to be protected, and that's the way to keep these things open. So we've asked for that statistic, 18 and over, and as well, the percentage and absolute numbers under 18. And then the third thing we've asked for is a clear tracking day by day at any point in time of the number of people that are vaccinated and the number of people that are unvaccinated who fall into the categories of hospitalization and for those fatalities. We think that's important to know. It has been posited that when you are vaccinated, it is less likely that you'll get the disease and less likely you'll suffer from the disease, and that has generally been true. But we think we need to show those numbers on a day-to-day basis so that people understand what the benefit of the vaccination is. And it's particularly important because when you look at people who are vaccinated, they may have underlying health care issues that compromise them even though they're vaccinated. They may be partially vaccinated, not fully vaccinated, but we need to know what percentage of those people versus the percentage of those that are unvaccinated that are now suffering from hospitalizations and then unfortunately from fatality. So we've asked the state to provide this data. We hope that they'll respond positively. We cannot generate the data on our own. Hospitals, nursing homes, all vaccination centers, all medical offices, they all report to the state of New York, and the state gets that raw data, and how they decide to process it is within their decision-making process, but we're asking them to please make the effort to provide us this additional information so we can provide it to you, and then you can have a better understanding of what's happening out there. We think that that's very, very important in the way all of this shakes out. I want to highlight as well that if you are in need of food assistance, if you're isolated and you can't get out of the house, you don't have anybody else in your household, and you need food, if you're in a situation where your resources do not allow you to order in every night, then there's a phone number you can call, 995-5566. Easy to remember, 995-5566. That's during normal working hours, Monday through Friday, 9 to 5, and that direct line will help you get assistance in receiving food. We have a lot of food pantries out there, but they require you to go out, stand online, and pick up a bag of food that for you and for your family. In this case, you can't go out of the house. You still need the food. Dial 995-5566, and the county has structured that as a way to be able to help you in accomplishing that particular task. We also want to mention that We're always in the lookout for volunteers. Volunteer New York is a wonderful not-for-profit agency. They're very active yesterday and the day that honored Reverend Dr. Martin Luther King. They're very active on 9/11 days that symbolize volunteerism and an effort being made to try to help our fellow residents. And our partnership with Volunteer New York is targeted for recruiting and training volunteers for the County Center's vaccination clinic. If you're interested in helping as a volunteer, you can go on Volunteer New York, all one run-on word, .org/vaccine, volunteernewyork.org/vaccine. You can sign up, and with that, we look forward to being able to utilize the benefit of your volunteer service, which we think will be helpful. We need that assistance in order to provide these vaccination clinics on an ongoing basis. We've always had a strong commitment to volunteerism in this county. The number of organizations for which people put voluntary time in is legion. And this is one of those other ways that you can show your assistance and help. And we want to thank Volunteer New York for partnering with us on this program. It will continue through late April. And all of the recruits will get personal protective equipment, PPE, so that they'll be protected as part of their effort. And we appreciate that. In a non-COVID related issue, we want to mention that we have now seen the moratorium on evictions lifted as of January 15th. Now, this is the first workday, January 18th. Since that date, if you are in a desperate situation and you get a notice from your landlord of eviction, do not sit on it. Do not look at it and stare at it, file it away and think it's going to go away. It will not. You need to reach out for assistance. The state has set aside money through an emergency rental assistance program called ERAP. Some of it's been funded by the federal government. There are other programs that exist out there as well that can help individuals who may have fallen behind in their rent in a significant way. This also applies to your utilities as well. But you have to reach out. Our social service department, our planning department are both available to help. You can call any of our DSS district offices at 995-3333, easy to remember, 995-3333. Tell them of your situation, tell them you need some help, and we'll be able to work through with you to some degree. We have nonprofit partners that are experienced in the housing area: Community Housing Innovations, Westchester Residential Opportunities, Washingtonville Housing Alliance, and Choice of New Rochelle. And each of those organizations can give you the help that you need. But you need to know that you're in a situation that requires assistance, and you're going to have to reach out for it, 995-3333, and hopefully that will help you along the way. Before we go to questions, I just wanted to highlight that we lost a member of our Westchester family over the weekend, very suddenly. Reginald Lafayette, resident of Mount Vernon, passed away Friday into Saturday, and it was a sudden situation. Reggie, whom we know by his first name, was not in ill health to our knowledge, and yet we found out that we have lost him. He was the commissioner of the Board of Elections, one of the two commissioners. There's a Democratic commissioner and a Republican commissioner, and Reggie served in that position for over a decade and a half. He had been a former city clerk in Mount Vernon, former deputy controller in the city of Mount Vernon, very active in the political life, head of the Democratic Party for over a decade and a half, and critical in so many different areas of both government and in politics. And it is a difficult thing for me personally, because I've known Reggie Lafayette for almost 50 years. We were young men in our 20s in Mount Vernon. He grew up in South Carolina, but came to Mount Vernon at a very young age, worked in the insurance industry in New York, and I was involved as a budget analyst, first job out of graduate school. We both found ourselves working similarly in the government of the city of Mount Vernon back in the mid to late 1970s, and formed a long-time friendship. And as happens to any of us, when we lose a close personal friend, it is more about who that person is to you. I managed the Little League baseball team, and Reggie was my right-hand coach for that team back in 1978. So those kinds of things and the social gatherings you have mean a lot to you as an individual. But Reginald Lafayette, as head of the Democratic Party, as head of the Democratic Commissioner, had a tremendous impact on this county. We look forward in the days to come to give him the recognition that his life and times deserve. We'll have some announcements in that direction in the days to come. We understand that details are still being worked out for a wake and for a funeral service that will probably happen the last Friday and Saturday of the month of January. We'll have that information certainly on our social media. It'll be out in the general public domain. But I mentioned just on a personal level a couple of weeks ago, just in this brief few weeks of this year, I've lost people that I've known and worked with. Joe Lanza, who was a former mayor of the village of Mamaroneck in the 1990s. Joe Falcone, woman who was a White Plains city councilwoman, served in this city. Pat Gorski, who was the clerk of the Board of Legislators, served as clerk when I was chairman of the board in roughly the same era in the late 1990s and the early 2000s, and now joined by Reggie Lafayette. These are people that I knew and worked with, and other people knew and worked with, Republicans as well as Democrats. We managed to find a way in those days to do what we don't seem to be able to do now, which is to like each other and to work across whatever our differences are and find what links us in commonality. But we look forward to recognizing the life and the times of Reginald Lafayette in a way that would be appropriate and profound. And when we do, we'll make sure we announce that to everybody, and we hope that you'll be able to participate. Because of COVID restrictions, we expect that the wake and the funeral will have restrictions accordingly. We'll have more information about how that'll be handled in the age of COVID. I suspect there'll be some way to participate remotely using our computer systems. But we pray for Reggie and for his family in the loss of his life and his times, and we won't forget him anytime soon. So with that, we'll go to questions. Catherine Chaffee, our Director of Communications, is with us. And Catherine, what questions do we have?
We have one question. Nassau County Executive has said that he has the authority over school districts to suspend the governor's mask mandate. Will you be doing the same thing?
No. First of all, I would disagree with the new Nassau County Executive. I think it is pretty clear to me, and as we've read the law, as we've asked our county attorney to opine, the governor's mask mandate order was a legal mandate order. She has the authority to do that, and in so doing it, I know that there are some county executives that have said they won't enforce it. We've said we will implement it, and we have over the course of the last month. We've implemented it by working with local businesses, churches, and so forth, providing masks to them, providing signage. My experience has been, as I travel around Westchester County, and I travel pretty extensively, there is a great compliance with that mandate. There are individuals who, for their reasons, ideological reasons more than anything else, feel that they don't want to comply with the mandate. But it's not because it's a mandate from a government official. It's because it's a common sense situation. The masks that we have on protect us from projecting to the greater extent whatever we have to somebody else, and protects us to some extent from what they have. None of these things are perfect. And when somebody says, well, you can still get COVID, yes, you can. You can drive drunk and get into a car accident. You can drive sober and get into a car accident. You don't drive drunk because your likelihood of getting into a car accident is much higher. And your chance of getting into an accident is much higher if you're texting while you're at the wheel. So you do prudent things, and it doesn't protect you from ever getting into a car accident, but it reduces the likelihood of that happening. And the same is true for masks as well. So I think my new colleague from Nassau County is in error, and we're not going to follow him in error. We're going to continue to follow the law, and we're going to try to implement it. The governor indicated that she plans to lift that provision at some point in time, and as the numbers come down, I think that's encouraging. But I've said a couple of times, and I'll repeat it again, we will get out of COVID. We will get past this moment. We will get to a point at which we resume much more of our normalcy. It may never be 100% the way it was before. Nothing ever is. But we can get there, but we have to use the tools. And if you're going to, for ideological or political reasons, reject masks, reject vaccinations, reject social distancing, then we're not going to get past it. And it becomes a self-fulfilling prophecy. And then I've also seen, this is not related to what the Nassau County Executive said, but I've seen people try to argue the numbers. They try to say, well, the deaths for COVID, well, they're not really COVID deaths. There are other kinds of deaths. It comes down to a justification for your point of view. You're trying to use any argument you can to say this is not serious. Tell 2,500 some odd families that it's not serious when they've lost loved ones. And if it is true that COVID combined to another disease makes you more likely to die, then that combination is important in trying to reduce so that you have less likelihood of fatality. A person who has diabetes and gets COVID, is much more likely to suffer than a person who has diabetes and does not have COVID. So to me, a lot of these arguments are really about politics. I'll save my political comments for a political arena. This is a governmental arena. But I understand why that policy has been promulgated out in Nassau County, but I don't believe it's legal. We are not going to follow that in Westchester County. We're not going to follow any county around us. I may like some of my colleagues who run other counties, but we are not going to follow them in a direction that I perceive to be objection for political reasons, not for scientific reasons. If there are no other questions, we thank you for watching. I'm George Latimer. Ken Jenkins joins us here. We'll be back next Monday at 2 o'clock for the next update. We hope we can continue to show that the numbers are dropping, less people hospitalized, less infection, and that will show us a good sign that as we get through the winter, heading toward the spring and heading toward the summer, we have less of a COVID concern, and hopefully that'll be the case. Thank you for watching. Have a good day. Be safe.